Fertig? Okay, good morning. Welcome, everyone. Welcome to the second webinar of the Public-Private Partnership Photonics 21. This webinar is on the Horizon 2020 call on COVID-19, which has been published only yesterday. So it's very up-to-date information you will receive today. The call topic, and I have to read it actually, is second call for expression of interest for innovative, rapid health-related approaches to respond to COVID-19 and to deliver quick results for society for a higher level of preparedness of the health system. This is part of a bigger COVID-19 package by the European Commission. And we are very happy that we can present to you now the detailed information on this call. I would also like to welcome our colleagues from the European Commission. That's Saila René. Both are coming from the Directorate Connect. Saila René is head of sector in the e-health unit. And second, and you probably know all, John McGann, who is deputy head of the photonics unit. So the agenda of today, we want to make it short and crisp. So with this welcome, in a minute, I will hand over to Saila. We'll have a general introduction to the call, a background on the context, and then we'll have a specific focus on one part of the call, which is most relevant for photonics. So there we will make a more deep dive, and this will be done mainly by John, but also by Saila. Afterwards, we'll have a Q&A session. So we ask you to take the opportunity and get first-hand information if you have any questions. And then we also give some information on the other call topics, which may also be relevant for our constituency. And at the end, we have another Q&A session. So I would, and by the way, my name is Marcus Wilkins, and I'm working at the Secretariat of Photonics 21. So let's see whether I see the next slide. So we would kindly ask you to interact with us in two ways. So first, at the bottom of your page, you will have a Q&A section where you can just put your question in, so in writing. And you should have another possibility, and that's the virtually raising your hand, so that we see that you want to say something. We will try to bring you into this discussion and that you can speak up and raise your question, and we will hand over these questions to Saila and John in order to get the direct response to this. During this webinar, we will have several polls, and the first poll should start right now or in a second. We would like you to respond to, because we want to have get more information who is in this webinar actually. And after this webinar, we will have a feedback survey. We will ask you about your opinion about the webinar and what we can do better. So, so now you see the poll, and please respond to it. We will share the results in a minute. And can I see the next slide? So, and now I'd like to hand over to Saila René. Saila, could you start?
Thank you. Now I can see that I have control of the screen. Can we take out the poll then?
Yes.
But now it's under my control. So shall I just close it?
You can just click through it and put the box to the right end of the screen. So
now it's gone.
Yeah.
Okay. So good morning from my side as well. I'm Saila Rinne. I work for the e-health wellbeing and aging unit in DG Connect. I'm based in Luxembourg. We are going to present now with John this call for expression of interest that was published yesterday. It's a very fast track call. It's not a normal call for proposals. So you will see that you have to act fast if you want to submit proposals for this call. It is about solutions for rapid improvements in understanding, mitigating, and responding to COVID-19 pandemic. Now I'm trying to move forward with the slides. Hopefully it works. So a few words about recent activities around data, AI, and supercomputing in response to the pandemic. Since the beginning of the COVID-19 outbreak, the Commission has intensely worked with the member states in order to come up with the common principles and for the use of technology and especially mobile applications and data in response to the pandemic. There were two policy documents that were drafted on a very short notice in April. The Commission recommendation that sets the principles of the use of technology and data in support of the COVID-19 crisis. And then as a follow-up to the recommendation, there was an e-health network document that was published on the 16th of April, which goes into more detail on the so-called toolbox for mobile applications used for contact tracing and warning. These activities are going on constantly, and there will be more, let's say, more information coming up most probably next week on more details and technicalities around this topic. Then when it comes to AI and robotics, there's an initiative called AI Robotics versus COVID-19. It's repository of solutions and initiatives to bring together existing knowledge and resources across Europe to tackle the pandemic. And then there's a project called Escalate for COV, which is using supercomputers to research drug therapy against COVID-19. This was one of the projects that was selected from the first call of expression of interest that I will explain in a few minutes. This project has a library of 500 billion molecules, and they are the processing capacity of more than 3 million molecules per second. So this project really brings the computing capacity needed to find the therapy. Then on top of these, there have been a lot of other EU initiatives and projects working on computer-based modeling to estimate the scale and duration of the outbreak, to help monitoring the development of the outbreak, support mitigation measures, and so on. And of course, on top of all these, there are plenty of other activities ongoing, including also re-steering existing ongoing H2020 projects to address the COVID pandemic. So this second call for expression of interest, as well as the first one, go under the Societal Challenge 1 health part of the H2020 work program, so the funding comes from there. This part of the program has both digital and non-digital topics, and we are managing this part of the program together with DG RTD. The first expression of interest was published in January. There were no, let's say, technology or connect funding involved in the first call for expression of interest, but there were projects that were also dealing with technologies, as you saw for the supercomputing project. So it's worth having a look at the 18 projects that were selected for funding from the first round. This call was rather generic, much more generic than the second call, which is more prescriptive, you will see. And the first call was focused on advancing the knowledge on coronavirus and its impact on infected persons, about efficient patient management and so on. So more like therapies and diagnostics tools. Whereas the second expression of interest, first of all, it complements the first one, and it does not target completely new diagnostics therapeutics or vaccine compounds or solutions. The idea here is really to deploy existing solutions and bring them into market. So it's about mature solutions, whereas the first call was maybe more on the research side. And the other thing about the second call is really to focus on the next steps and what happens after, to come out of the pandemic and to get prepared for eventually a new wave or a new pandemic. So as I said, we are now calling for innovative health-related approaches to respond to COVID-19. We would like to see quick delivery of results for society and also a higher level of preparedness of health systems. This call aims at rapid delivery of innovative solutions, so mature solutions, in order to contain and mitigate the outbreak and to provide better care for patients. And then, well, there are 5 different areas, which means 5 different topics within this call. We will explain them in the next few minutes. So it's the broad areas are adaptive production methods and innovative mature technologies to address immediate needs in healthcare provision, evidence-based guidelines on containment and mitigation measures, and cohorts to identify factors influencing the susceptibility to infection and therapeutic response. When you go and have a look at the topic text, whichever topic, you will see quite a lot of text which is common to all 5 topics, and it's really worth looking at each and every box and like expand all the boxes on the portal and read all parts, because they are all relevant for that specific topic, and some of them are common for all topics. There are elements such as strong involvement of end users that has to be taken into account. Also, the objective is to make healthcare systems and societies more resilient to pandemics in terms of prevention, protection, and treatment of population and patients. We expect to see faster and more impactful, cost-effective, and larger scale implementation of the solutions that are brought forward. Also, the gender-related issues, whenever relevant, need to be taken into account in the work that is proposed. For example, if there are gender-related issues that have to be taken into account in the product development and validation phases, then these need to be explained. This point is not referring to gender balance within the consortium. This is a mistake we have seen in the past. So just to remind you about that. And then finally, we expect the solutions to be readily available and completed during the project lifetime. So these are the 5 topics. We have repurposing of manufacturing with the total budget of 23 million euros. Then the main topic of today, medical technologies, digital tools, and artificial intelligence analytics to improve surveillance and care at high technology readiness levels. The total budget is 56 million. Then we have the topic on behavioral, social, and economic impacts of the outbreak response with the total budget of 20 million. And pan-European COVID-19 cohorts, and with 20 million budget, and a coordination and support action of 3 million around the cohorts. Then I hand over to John, who will start with the medical technology topic.
Okay, thank you very much, Sila. So my name is John McGann. I'm Deputy Head of the Photonics Unit. And this has been a beautiful example of cross-commission collaboration. We've been collaborating with our colleagues in DG Research, and I've been collaborating with Sila inside DG Connect on this. So it's quite a broad range of technologies, but this is one that's a little bit closer to the area that I'm comfortable with. So, but this topic B, we feel, is much more relevant to most of you. By the way, do I have control? Yeah, because it's really much more technology focused, and it gives a range of technologies, including photonics, but which I guess a lot of you are familiar with, but not only. Now, we will, after presenting topic B, return to topic A, because that could also be of interest to many of you as well. We'll get there in due course. Oh, Barbara, do I have control? Or next slide, please, then. So, no, I don't.
So,
no.
So you should have control.
Yes, now I have it. Okay. So the first thing to note about this topic is compared to many of the calls for proposal that you're probably already familiar with, is that we're calling for innovation actions rather than research and innovation actions. So this means that we're talking for topics that are much closer to the market or at higher technology readiness level, to use our jargon. And so this is the very first important point. We want to get technologies that are quite mature, quite well developed, and just to get them over the final hurdle, to get them out of the laboratory environment and into testing and deployment. So there's two main two types of actions we're referring to: type 1 and type 2 actions. The first one is on the large scale testing, piloting and deployment of the technologies and solutions. And the second one is more lab to fab. So this is about further developing and maturing solutions that already have been validated in the lab environment. Here we're talking about TRLs 6 to 7. And in both of these cases, it's really about trying to validate them in the community and maybe to conform to achieve the conformity assessment, so the CE marking, so that these can be used and used in the field as soon as possible. So who are we trying to address with this call? Well, we really want to address the innovative technology providers, such as high-tech SMEs, but also healthcare professionals that can validate and see how these solutions will work. Now, we recognize that many of these players are already quite tied up with dealing with the COVID crisis at the moment. So we're trying to be as flexible as possible. So if these technology providers, they can either come together and form consortia, innovation action consortia in the normal sense, with 3 or more members to get together. But we're also calling for third-party financial assistance type actions. So in other words, these could be focused around centers of excellence like digital innovation hubs or photonics hubs. And these can form the consortia and then call for third-party type actions by themselves. So they will organize their own calls for proposals. And there's several advantages of this approach, because this means that they can act as centers of expertise and excellence. They can provide testing and experimentation facilities, but also give advice and on designing and engineering, and even pilot manufacturing services for the SMEs. So in this way, and also then they can spread best practice and exchange experiences between them. And also then they act as centers of expertise for certification. So we see this has been a win-win, if you like, to share the knowledge in the best possible way. So as I say, we're leaving it open for both types of action. Now to move on to the different technology areas and applications that we're calling for. So the first of these are techniques for sampling, screening, diagnostics, and prognostics. And this could include, for example, screening of lungs, or using advanced photonic technologies like plasmonics to detect the presence of the pathogen or pathogen-related parameters. And here we're hoping to be able to increase the sensitivity compared to conventional tests, so that we can, and also reduce the response time or the test result time, so that we can control the outbreak and the spread of the virus as quickly as possible. And this we think will help, especially in monitoring to protect against future spreads or resurgences of the virus. The second of the applications is more on environmental surveillance, because it's been discovered that we can detect, for example, the virus in sewage or in air. So this can serve as a way for monitoring its possible presence in a certain city or neighborhood, or also just a certain environment. And this can act just to warn against the re-emergence of the virus or against its spread in communities. As I said, this could be based on optical biosensors, but it could also be a genetic detection technologies. We're really not being prescriptive about the technologies here. The third is low-cost sensors, and this could include smart wearable devices, but it could also include robotics or AI for telemedicine, telepresence, and continual remote monitoring of patient parameters. So this is a whole range of tools and techniques that can assist the healthcare professionals, especially when they're stretched to the limit, and also to do things at an action that wouldn't otherwise be possible to do. The fourth is about protecting the healthcare practitioners and also the general public. And this can be, this topic here was originally inspired by considering some of the properties of graphene and graphene related materials. And these can be used, for example, to change the wetting and the filtering properties of fabrics. So for example, you can have face masks that are more wetted, or will form better barriers to the spread or the transmission of the virus. But we're also here talking about technologies that can be used for sensing or for sterilizing. So for example, we could have robots with UV sterilizers for public spaces, for disinfecting, and also techniques can be used to help in social distancing environments. And here we're not talking only necessarily about the medical field, but this could also help for the reopening up of society and public spaces, and also to reassure the public that it's safe to go back into the building or safe to go back into public spaces. And so in this way, we can try to help to get back to something that might pass for normality. And point E, which deals with data, but on this, I'm very happy to hand back over to Sila, because she's far more knowledgeable than me on this front.
Thank you. So I see that I have the control. Okay, I don't need it for now, but yes. So the last area is about data. So we are looking for new innovative data-based services and tools that collect data from various relevant privately held and or publicly available data sources. These could include AI-based solutions or exploiting data also from sensor-based signals, for example, and the aim is to support diagnostics, prevention, treatment, or rehabilitation with those tools. And here we have added the reference to the recent commission recommendation, just to remind that if there is mobile warning mobile warning and prevention applications or or tracing and warning applications involved, then the principles of the recommendation and the follow-up documents should be taken into account, and so it's worth having a look at those documents. If such tools are planned under this area, it's not, of course, only mobile solutions, it can be also something else. Okay, I'm trying to move forward. Yes, so the expected impact of this medical technologies topic, the idea is to contribute to public health preparedness and response in the context of the epidemic, and to ensure that there are critical technologies and tools available to support this phase of the pandemic. And then we are expecting the proposals to contribute, not to fully cover all the expected impacts, but to contribute to one or several of these. So the second one is about acceptability, adoption, appropriateness, and so on, sustainability of diagnosis and clinical management of patients and survivors of the virus. Then contributing to proposing recommendations for changes that would allow fast recovery and better preparedness. This is more for the data area. And then to accelerate deployment and market uptake of mature health technologies. This applies to all areas. We expect to see results within 3 to 24 months to end users at scale. The expected EU contribution per proposal is between 2 and 5 million euros when there is no financial support for third parties planned. For proposals with FSTP, the contribution can be up to 10 million euros, and I mean any other amounts can also be proposed. These are just recommendations. You have to remember to specify which type you are addressing, type 1 or type 2 in the proposal. At least one proposal will be selected of each category or type. The maximum duration is 2 years for the projects. Then a few words about the financial support to third parties. There is a specific annex of the work program or part K of the general annexes, where the main principles of the financial support to third parties are explained. For this topic, we consider that this support would typically be in the order of between 20,000 and 100,000 euros per third party, and this support can only be provided in the form of grants. You need to, if you go for this option, you need to also specify the amount that the project is going to use for the FSTP. There's a specific column in the budget table to fill in. And you need to provide the details of the FSTP in the proposal section of 4.3. So it's not in the 1 to 3. You can of course explain it there as well, but there's a specific place for providing the details of the FSTP. It's section 4.3. You need to specify what are the objectives and expected results that you wish to achieve with the FSTP. You need to specify what are the activities that qualify for financial support, what will be the criteria for awarding the financial support and for calculating the amount to be allocated, or because it will be a competitive open call for third parties. And those consortia who choose to go for the FSTP, they have to be ready to launch the competitive calls very soon after the start of the project, preferably within, or we say within a month from the start. They need to provide in the proposal evidence on how they will convincingly be able to reach a large number of potentially interested organizations, and they have to have a track record of having done this already before. Then I hand over to John for the practical tips.
Sorry, I'm very bad at multitasking. I was trying to answer some of the questions online. So just some practical tips, because despite the fact that we deal very often with a lot of very intelligent people, sometimes they can still make the odd mistake. So just as a little reminder, respect the page limit in the proposal. So it's 45 pages for sections 1 to 3. I believe, Sila, that they can elaborate, proposals can elaborate a bit more about how they're going to manage the third-party funding and those calls in a separate part of the proposal. Is that correct?
Yes, yeah. It's section 4, so it's not within the page limits, yes.
Okay, good. Secondly, to please make sure you address and submit under the correct topic, and have a look quite carefully, because maybe some of the other topics could be more relevant for your area of expertise. Thirdly, I mean, because we're offering the possibility of either a standalone project, an innovation action project, or one through third-party funding, think about which might be more appropriate for you in your situation, and also with your knowledge. I mean, would it be better to form part of a larger consortium which is also offering third-party funding? Maybe you will wait to apply for third-party funding if you know that one of the medical centers of excellence or the digital innovation hubs will be issuing a call for funding in due course. And that's because what we're really trying to do is limit and reduce the administrative burden for many of these innovative SMEs. So think about which might work better. Use your network as far as you can. Another point is, please double check if you are writing a proposal to us, get somebody who hasn't been involved to look at it with a neutral and critical eye, because often people get so caught up in their technology or in their area, something that they think is obvious to them isn't actually obvious to the evaluators. And we can only evaluate proposals as they're presented. Even if we might know what you might have in mind, if you haven't said it, we can't believe it. So you've got to make sure to make sure that everything is covered there. Just a technical point, please do double check the PDF conversion of your proposal. We have received various technical levels of gobbledygook with track changes, and we really need to have something that's legible for the proposers or for the evaluators. And also consider the evaluators, they need to be able to read something easily. So try to do it as clearly as possible in your layout and content.
If I may add that also the evaluation process will be very fast track. So take that into account when you write the proposal.
Make everyone's life as easy as possible, including your own. And finally, given the urgency of this call, we've got a very short deadline. So the deadline is just over a month away, on the 11th of June at 5 o'clock Brussels time. So it's a very short time, we know. Okay, if you're hoping to get a third party, sorry, oh, do we? Yeah, if you're going to apply through third-party funding, then you probably have a bit more time. But please don't wait until the last day, or the last minute, or even the last day to submit. If you're drafting a proposal, put your advanced draft in early, and then update it, because sometimes technical problems at the last minute might mean you might not be able to have the very last version, but at least if we've got a previous version, we've got something we can evaluate. So this is just a practical tip. And I think that's it. Now we're to the question and answer session. So,
hello, I'm back again. I take over. So thank you very much, John and Seiler, and also thank you very much for all the participants. We have about 150 participants in this webinar, and we got a lot of questions. And I was actually surprised, John, you already responded to some of them. So this is for the participants. Please also follow the chat. So some of the questions raised were already been answered and responded to. Before we start with the questions, I would just like to share with you the outcome of the first poll, where we want to show to you who is in the call. That may be valuable information for Seiler and John. So when we respond to the questions, so it's nearly evenly split between very experienced people, some experience, and no experienced people. Just to keep that in mind, I think, and now I try to sort the questions a little bit. We have some questions which are a little bit of technical nature, which is, for instance, is Tunisia eligible as an associate country to apply?
So all the regular rules on H2020 when it comes to eligible countries, associated countries, all those rules apply for this call as well. So there are no exceptions in that sense. So that there are the annexes that are also, the links are on the funding and tenders portal to all the annexes where all the countries eligible or not are mentioned.
Okay, and I just see another question coming in asking about the UK.
I think for the moment the UK is a full participant, Sila. If I,
yes,
nothing has changed for now.
Nothing has changed. Yeah. So and also this information is on the portal if there are changes, but for now UK is considered as a regular applicant.
Yeah. Okay. So then we have some questions about whether we will share the PowerPoint presentation. We will do that. So you will receive from us this file. And then we do have some technical questions. One is towards John. John, could you please explain again the role of this call for digital innovation hubs that are not yet constituted but are in the making?
Actually, I don't know. Sila, I'm going to pass this one back over to you because I think you're more familiar with this than I am. Sorry.
Yeah, well, in fact, yeah, no problem. So we didn't, in the topic text, it's not a closed list of providers of support services, pilot lines, whatever. It is really like bringing into the consortium the support services. It's not about whether it's called Digital Innovation Hub or whether it's existing or not, but it's the services that those organizations are able to provide that count. So this is the idea. We were not trying to list only the, let's say, name certain types of organizations, but the idea is the emphasis is on the support services that are mentioned in the text.
Yeah. Okay. Then we have other questions, for instance, and also to Sila, can you please reiterate the FSTP details are to be described in section 4? Usually I would expect proposers to put information already in section 1 and 3. Should this guy ask the national contact point, or could you respond?
Well, if you start applying, you go to the portal and you get the template, proposal template. You will see that there is a very specific explanation for the section 4.3 what you can explain there, and of course when you explain the whole concept of the project, you need to explain the FSTP on broad lines, but the details can go to section 4.
Right. Okay. Then let's see. I think many questions have been answered in parallel by John already, right?
I'm doing my best, but
yeah. So we have so somebody who's new to H2020 proposal submission. The question by Donald Lucas suggests that the consortium has to be at least 3 partners from 3 different countries. Is that correct?
Yes.
Yes.
Yeah. So what is the whole timeline, and probably also the evaluation procedure? Is that a standard evaluation procedure, or are you trying to go to go new ways? So will it be remotely or?
Sorry. Which side? Remotely? Well, the evaluation will be done remotely.
Yes. The evaluation.
Yeah. Yeah, we have to do. Yeah, we have no choice. But in fact, we'll probably end up doing much more remote evaluations in the future anyway. But certainly in this case.
Okay. So another question raised is, could you share the link to the call? I think this link has already been shared with all of you when you received the information how to dial into this webinar.
It will be also on the very last slide.
Yeah.
The link.
And Mike Richardson asked, use existing photonics instruments, for example, existing spectrometers from company.
Yes, why not? I mean, we're really trying not to be too prescriptive here. So, and existing instruments would be good if it can accelerate the development of the solution. But of course, we're not going to pay. We want to. We have to get some added value. It shouldn't just be using an existing solution. I mean, there has to be some novelty involved. Otherwise, there's no point in replying to the call, I would say.
Yeah, okay. So Mike Richardson raised a question, other specifically related to new research regarding new biomarkers. Biomarkers, new detector is spectrographic, requires support to advanced TRL from 6 upwards, I guess. Would that be in the scope of the call?
I think you could make that case. I mean, I would say yes, but I'm not. In the end, it's down to the evaluators to also consider what the expected impact. I mean, if it's something, okay, if it's actually TRL 6, but could get onto the market and achieve the expected impact within the time scale we've asked for, why not? I think it would be considered as being in scope.
Okay, and another question raised by Ronald, would new disinfection technologies also fit in the scope of the call?
Yes.
Okay. Then Adrian raised the question, do we need companies or SMEs on board?
Well, normally we would expect, I mean, the call is addressing SMEs. It's really not a research call. It's a call for trying to get the results out onto the market. So we imagine we'll have SMEs and startups primarily, right?
Yeah, and as John said earlier, these SMEs and startups can be either members of the consortia now or beneficiaries of the third-party grants later on, if it's a third FSTP project.
Okay, thank you very much. And now we see that we have 2 participants raising their hands, and we try to bring them in so that they can speak up. First is Eric Reita. Eric, you have to unmute yourself. Eric, I think we can hear you now. So, Eric, can you raise your question?
Yeah, sure, thanks. I just lost the connection, so sorry if I didn't hear you.
No problem.
My question was actually to John. considering that they are not speaking about imaging technology, and considering the fact that photonics is in a way seen as one potential field of technologies. So what area do you see photonics technologies, if they are not imaging technologies, are fitting into within this scope of topics?
Well,
Because,
it could be some imaging technologies, and I don't know, looking at.
well, in my case, it's not, and I don't see
Okay.
a topic within those which are described to fit my technology, which is actually a treatment technology based on lasers. So how do you see? Is there any chance to apply?
Well, for example, I don't know, maybe for surface treatment for antibacterial properties in something that's being used.
You have now the slide on the areas if you want.
Yes, but the only one I can see more or less fitting is area E, but it's for data-driven solutions.
Okay.
That's my concern, basically.
No, but we imagine that we could have photonics for example, sterilizing. We could have photonics for detecting of the pathogens or of some other markers of the pathogens, in either using plasmonics or I don't know, also spectrographic techniques, pattern recognition, or a combination of AI and imaging for pattern recognition for diagnostics. I mean, we're really open here. We're not being prescriptive. So if it's objective driven rather than technology prescriptive. If you've got a way for addressing some of these areas, we're not saying what technologies need to be used. Sorry,
what I mean is that actually treating pathogens does not fit to this scope. I mean, treating pathogens using laser-based technologies.
I wouldn't think so. That sounds much more upstream research to me. What do you think?
And if you address this question to me, we are not speaking about research. We are speaking about the technology which can be actually applied for this kind of.
I think we need to stop it now in view of time. Probably
okay,
you
no
can.
problem.
We feel free to follow up bilaterally, and we can discuss later.
So we have two other participants raising the hands, and I would like to ask them just to put the question up very briefly. Otherwise, we'll run into a problem with regard to timing. So Manfred.
Yes, good morning. Thank you. First of all, thank you for bringing this information to us so in such a timely manner. I know that the overall webinar for this call is only scheduled for today afternoon. I'm working as a national contact point. That's where my technical questions come from. And I wanted to ask one question, that is, the proposal is supposed to be shorter than usual. Did you all also change the template accordingly? And is it to be found on the portal already, the template? And the second part, I just want to raise the information that, of course, with questions concerning this call, you can also get in touch with your ICT national contact points and with your health national contact points if you want to submit a proposal. Please feel free to do so, everybody.
Well, in fact, we would really encourage proposers to go to the national contact points as the first port of call, not only to answer the technical questions, but maybe could also help you in finding partners that would also might want to cooperate with. And regarding the template, I believe yes. I think that the template should have been adapted for this.
Well, it's the page number is 45. When I quickly checked it in advance, to me the template, let's say the structure is the same as for any innovation action, but of course we expect less text for each of the points.
But it's a further challenge for the proposal, because usually they struggle to keep within the 70 pages limit. So it will be interesting.
Yeah, well, also the time to propose is very short, so yeah, it has to be to the point.
Yeah, the theory, of course, is always that a shorter proposal is quicker to write. I'm not convinced myself, but that's between us.
But this is the same for all 5 topics, so that's the idea.
Yes, as well. Yeah. Marcus, will I get to continue the Q&As online? Will that, even after the session is over?
Oh, hello. I was putting myself on mute, so I was talking already. So, we have now put up a second poll to you. So you have received the information on the most photonics related call part, and we would like to know from you, are you now interested in submitting a proposal to the call? Please respond to it. We will share the information with you later on again. I think we take the last question, and there is Saha Vadadi also has raised the hand, and Sarah, please speak up. Saha, you should be able to speak now. So if Saha does not speak up, I think technically it should be feasible, Saha.
Yes.
I see that you're, yeah.
As it's a data question, I don't know if Sila, if you can see his question there. It's about the open data incubator.
No, I can't see it.
Hello, do you hear me?
Oh yeah, now we hear you. Yes.
Now we hear you.
Okay, sorry, it was my microphone problem. Thank you very much. Very informative webinar. I am from AI community and already working with healthcare centers about COVID-19. I have a question about the idea whether our work can be interesting here, because you emphasized on maturity of the idea behind, or the ultimate results that should be delivered in 2 years, which can go directly to the market. Of course, our AI-related algorithms and the things that we have are matured enough, but we are already facing problems which are data-driven, because of the quality and quantity of the data available from healthcare centers. So for me, the question is that, do you really want to have a device, wearable, or the examples you gave about disinfection and so on, assisted by AI, like perfectly working? Or because you emphasized several times that this is not a research-based call, or the idea can really be investigating more about the changes happening for the lungs, and scanning the images there, and having more assist from AI, like kind of recommendation for experts in ICUs and the intensive care rooms. So these are the ideas that we are already dealing with. That is why I want to see whether it suits for the call, the ideas that we have.
Well, we don't give advice on specific proposals or proposal ideas as such, but of course, there has to be something tangible coming out after the end of the project. So that's the principle. Of course, if you have algorithms and you have lots of data, maybe you need support in order to work better with the data, have data curation services or whatever is needed. But then something has to come out as a tool, product, recommendation system. Something needs to be taken or brought to the market in the end, within the short timeline.
Okay, thank you very much. I think we should now move on, and so we couldn't respond to all of the questions, but just for you to know, if we will not manage during this call, we will reply to the questions and make the answers available to you. But in view of time, I would suggest that we now move on with the second part of the presentation.
Yeah, so we will very quickly go through the other topics that are part of this call.
And
perhaps, John, you take the manufacturing. Could you unmute?
Oh yeah, sorry, I'm not very good at multitasking. Yeah, so just I will just very quickly go through the first call topic here, which is about the repurposing of manufacturing. Now this is yeah, so this has got two main objectives. One of them is about looking at manufacturing of medical equipment, such as personal protective equipment and ventilators, to help address the crisis. So to see what can be done to repurpose or accelerate the production of this equipment, and also diagnostic technologies based on advanced materials, service systems, and automated systems. But it's also about adapting production and manufacturing to operate in this type of environment, in this type of situation where we have the crisis. So about how to reduce the risk in manufacturing lines, proper risk management, how to avoid disruption of supply chains in manufacturing, maybe the deployment of automation technologies that are less dependent on personnel, or how to qualify operators or technicians to operate under this new environment, or when getting back to work in the manufacturing area. Now, we are not experts on this. This is something that's organized by our colleagues in DG Research, and there's going to be a bit more information available in a webinar later this afternoon on that. But we did want to mention it here because we think this could be of relevance to some of you. But please don't ask us too much detailed questions on it. And now I'll pass back over to Sila.
Thank you. So I will quickly go through the three remaining topics. We have behavioral, social, and economic impact topic, which is about developing guidelines for the future and implementing interventions to mitigate impacts and boost well-being amidst the pandemic and afterwards. Here it's about integrating multiple medical, social sciences and humanities in order to analyze and compare outbreak responses in different countries, impacts on human behavior and social dynamics by different regions and countries in Europe, addressing the immediate and long-term mental health impact of the crisis. So, and this, this is the research and innovation action. And the manufacturing topic was innovation action. Then we have two topics on COVID-19 cohorts. One is the actual cohort topic, which is working on population-based COVID-19 cohorts to have a solid cohort on non-infected and infected individuals to identify risk and protective factors and to deliver evidence-based recommendations, and also to identify the most successful clinical management options and treatments of the coronavirus. Then related to this cohort topic is coordination and support action, which is about networking existing EU and also international cohorts of relevance to COVID-19. So it's about pooling the data from multiple existing cohorts and to collaborate to create a cohort framework to rapidly address the pandemics in the future. And just to mention that the first cohort topic is research and innovation action, and the last one is coordination and support action. Finally, we had we put here the full list of links of all 5 topics. So these links go directly to the topic text and application interface. Read very carefully your topic text before applying, and the information on the funding and tenders portal is the only official source of information concerning the topics, and if there are any changes, they will be reflected on the portal. Oops. So this is the end.
Okay, thank you very much. So all participants now get a full overview of the call topic, and we wanted to ask whether there are any additional questions. We still have some open questions, which we may come back, I think, in a minute. We could share the results of the second poll with you. We wanted to get a feeling who is now, when having all the information available, who is planning to submit a proposal. And 73% are planning to submit a proposal, which is, I think, a good result. So the call text obviously matches with what people think photonics can offer to solve the corona crisis. We know that there is a very short deadline, and that's an issue to all of us, I think. And later on, we will also ask you, so all participants, whether you need some further assistance in matchmaking. So that will be the last poll we will put up at the end of this webinar. And depending on the response, we will set up another webinar upcoming Monday already. And we would ask those who are interested to make a presentation to the others. There's also the possibility on the core website, I believe, to just start a partner search. So this is also a possibility. But now I would say, let's come back to the Q&A and see which questions we have not answered yet and which we could answer. So first, there was Bert has asked a question on the webinar this afternoon. I think we can make the link available, right, to this webinar. That's no problem. Then there's a question from David Armstrong. Is there a suitable third-party hub in the UK? I'm not sure that Sila or John could respond to this question. That's probably more an issue for the matchmaking.
Yes, I don't know, Sila, if there might be, there must be a UK participant in some of the ones, one of the hubs, no? But
yeah, but I would also maybe refer to the national contact point and the networks and the matchmaking events on that.
Yeah, there's another question in proposals including FSTP. Is there any internal recommendation on the full amount of budget that should be dedicated to it?
This we have explicitly left open to the proposers to decide. So it really has to be appropriate for the activities that are proposed, let's say, versus the support activities versus the third-party funding. So it has to be a good balance.
Mm-hmm. But the individual third-party funding is in the range of typically 20 to 100,000, if I remember correctly.
Yes, and it cannot be more than 100,000 because it's already above what is set in the financial regulation. So we would not wish proposers to go above 100,000 per third party.
Yeah. Then we have another question: can a university participate beside SMEs?
I think I mean, universities can participate, but they should bear in mind that the expected impact is about getting products out and onto the market. So it's hard to see unless they're planning to get a startup up running in a very short time. I mean, we're trying to be as open as possible and not be prescriptive, but it's just very hard to see how only universities could achieve the objectives, right, Sila?
Yes, and it's as I said, it can be any organization that can bring in the expertise that is needed to bring the solutions to the market. So we are not limiting it, but it has to be meaningful, the role of the university in the consortium.
Okay, and then a question raised by Sahar again. Are you searching for an incubator like? And then there was a link. I think this probably cannot be answered on spot.
Well, I know this incubator, so I can say that yes, it could be that let's say that's a similar concept. Yes.
Okay. So I think there is one remaining question, and I'm not sure I understand it. I mean, open calls published by innovation support organizations.
Yeah, I think it's a follow-on for something else, but I missed the first part.
Yeah. Okay. So, and Manfred already shared the link to the webinar this afternoon. So community work is working. So thank you very much, Manfred.
Yeah.
I think, there is one other question coming in asking, will there be a new call for research proposals?
I don't, it may be under EIC. I don't know, Sila, do you?
Yeah, it's worth browsing the portal. There are calls coming up, but this is a very specific emergency call. It's a call for expression of interest.
Yes.
We don't know what happens.
Actually,
next.
the FET type actions, I think it's called Pathfinder. I think this is open. The old FET open, I think that's open to technology. So that's probably the best place to look at this stage, I would say.
Okay. Good. So the question, could you please provide all the links to the call and the relevant documentation? We will for sure do this.
I think it's in the end of the presentation, and you'll see it there.
Yes, we have the slide. Yes.
Yes.
And I mean, one of the things maybe to stress, and Sila, correct me if I get this wrong, but I mean, this has been done in a very short term, and we haven't figured out all the details. So, you know, we will try to use intelligence and a little bit of latitude in interpreting the results. So nothing is overly prescriptive, let's put it that way. So please consider the spirit of things rather than necessarily the letter, right?
Exactly, yes.
But I think that the community very much appreciates your work on this. And I mean, the participation in this webinar shows the huge interest here, I think. So with this, I think we can stop the webinar. Thank you very much to Sila and John, and also to all the participants. As we said already, we will provide all the information to you. And if you have any further question, don't hesitate to contact us. We will forward it. And as it was said by Sila, for very specific questions, you could, of course, the first contact would be the national contact point. And we can only encourage you to contact your national contact point on these. With regard to the poll for webinar on Monday, we will see, I think at the moment, can we share the outcome? So we have 24 people saying they're interested in having a matchmaking webinar, and 32 would only participate in this webinar. So yeah, I think so. We organize a webinar on matchmaking. We just have decided to do that, and we will share the information with you, and we will ask you to provide the presentations to us so that we can prepare for it. So thank you very much, and stay safe.
Marcus, before you get the very, very final word, can I just say thank you to you and Barbara and the colleagues at Photonics21 for organizing this. I think it's been very useful for the community at large, not only for the Photonics21 members. So thanks very much.
It was our pleasure. Thank you very much.
Thank you.
Stay well and stay healthy. Bye-bye.
You too.
Thank you. Bye.
Bye.